Hello, good afternoon. Welcome back to the show. It's
Good
been 3
afternoon.
weeks. Good afternoon, Nigel.
Kevin,
How are you doing? I'm
How are
good,
you
thank
doing?
you.
Good.
We are dealing in a pandemic, right? If you're to be honest, we're dealing it one step at a time. I'm dealing it one step at a time. So, how about you? How are you doing?
Okay lah, like that lah, like you all. just taking it one day at a time, enjoying the moments, enjoying and trying to keep my eye on the positive, but still doing mindfulness checks in the morning. So,
You know
Kevin,
what?
what are we talking about today?
Well, we are talking about COVID and HIV. And
COVID
also
and
like how we are
HIV.
dealing it, in especially in pandemic. So we also have special guests today. Would you like to bring them on, Angel?
Yes, please. Let's see who we're talking to. And I think we've got some
Hello,
special
we
ones.
have Azam. Hello, Azam. How are you doing?
Hey,
Hi,
Azam.
Good afternoon. Hi, everyone.
Would you like to introduce yourself?
Okay. First of all, my name is Azam, and I'm a program coordinator for DHSK programs under Majlis East Malaysia, and also a head of welfare for Jejaka organization based
Can
in
you tell us a
Lembah
little bit
Kelang.
about what Jejaka does?
Okay, Jejaka basically is an organization that we focus to more towards to GBQs, give advice and cure for helping towards on the psychosocial supports and also into social shelter and health. So about the health, we basically more focusing on HIV, which is that we have under Club Belia Kebajikan Setiap Alam KBKSA.
Very relevant. Very, very relevant. Thank you so much.
Welcome.
Thank you so much for sharing. Okay, next we also like to bring up Dr. Iskandar. Hi, Dr. Iskandar. How are you doing this afternoon?
Hi,
Hey,
Kevin. Hi, Nigel. I'm doing very well, thank you. Thank you very much for having me on your show today.
Thank you for agreeing to come on.
We are blessed and honored to have you present here today, to be honest. Would you like to introduce yourself a little bit? Perhaps our audience could get to know you a little bit.
Yeah, so I'm one of the infectious disease consultants in University Malaya. I lead the HIV clinical services there. And I've also been involved in a lot of COVID-related work because every infectious disease physician, practically every doctor has been deployed to COVID-related work. I also am a trustee of PT Foundation and the honorary secretary at MAC and a trustee at Malaysian AIDS Foundation.
Fantastic. Thank you.
Thank you, Dr. Iskandar.
And, I've always admired your work with UN. So thank you so much for all that. So today we're talking about COVID and HIV, Kevin.
Yes.
So I think the first question is, how are gay men coping with the prolonged lockdown? And what are the main challenges that gay men face? Perhaps I'll open it out to the floor if people can just chip in and chime in.
Absolutely. If I may. I'm a gay man, I put it out there. So as a gay man, and I'm dealing with this, I guess just like everybody else, I'm trying to learn. I think I'm learning everything, like all over. I feel I'm learning everything all over again. Stuck at home, you kind of had to like. I'm practicing mindfulness. I'm learning about myself. The self-care, self-love. Like all that different concept, and then so that I can, I guess, build my higher self when the world's are ready. I can actually begin to do my works out there. But at the same time, right now it's just try to do it a step at a time. So because that's how I'm dealing with it. How about you, Azam?
All right. I think that I'm working together. I'm volunteering with the communities that working for the men's sex of men specifically. So to be more to the question itself, there's a lot of challenge. Of course, there's a lot of things that happen to the community itself, to the gays community, about how they are coping itself, and also those who are gays and also living with HIV need. There's a things that happen and coping for their life during this pandemic.
So
Exactly.
Kevin
I
and
do agree.
Azam are basically grassroots and community leaders within. Kevin is with PT Foundation. Uh, that's a cute ringtone, Kevin. Azam is with
So
Juncture and
sorry.
NAC. So, Iskandar, maybe you can provide us a sort of a more macro view of how gay men are perhaps, since you look after HIV, so I'm sort of assuming you see more gay men in UM.
Well, I suppose what has to be said, first of all, it's not just disrupted gay men's lives, it's disrupted everyone's lives. But if
Sure.
you're specifically asking about, gay men or men who have sex with men, how, from a healthcare provider perspective, and whether that's from an NGO or from a hospital setting or a community clinical setting, I mean, the first thing that comes to mind is disruption of HIV treatment. A lot of gay men are HIV positive and are accessing HIV preventative services. So there have been disruption of both HIV prevention and treatment services. And we have some data on this. Gilead did a survey across, I think it was about 10 countries. This was around, I think it was in October last year, and one of the countries Malaysia was included in, and it shows on average between 40 to 50% of treatment and prevention services were disrupted. So, it has a knock-on effect on people accessing care, on people on HIV testing services, and on disruption of people who are already on antiretroviral treatment. And we have yet to see the long-term effects of these disruptions, not just for HIV treatment and prevention, but also the knock-on effects that COVID has had on the care of other diseases and infections, like diabetes, cancer in particular, which affects everybody. So, I think first of all there needs to be a realization that COVID has disrupted that in a major way, and we will only begin to see the effects of those once the community transmission starts to increase, and we're seeing other people accessing care for other reasons.
Right. Um, so basically, what you're saying is that out of the 10 countries, we've experienced a 40 to 50% disruption of all services,
No, no, no,
medical services.
no, no, no.
Sorry, that broke up a little bit.
Sorry, the survey done by Gilead through Malaysian
Okay.
AIDS Council was largely focusing on HIV treatment and HIV prevention services. So that was specifically around those services.
Okay. Okay. Are there more challenges for gay men? The reason why we're directing the questions towards gay men is because obviously it is with the PT Foundation, and PT Foundation seems to focus on that particular area.
Yeah.
So,
Okay.
so do you feel that gay men face more challenges with regard to like HIV treatments and all that? Do they get less of a priority, or is it just that everything is just
No, I think it's across the board. Gay men are particularly better than other risk groups at accessing services. Certainly from a community-based organization perspective, I found. And also within the hospital care that at least has gay-friendly services. They are generally better than other key populations accessing care. Now, with respect to specific services around gay men. So I would say mainly it's affected HIV testing. So less people have come forward to get tested, especially if it's facility-based testing. The knock-on effect, of course, of that is there's been an increase in HIV self-testing. So that's been good. You know, there's been a HIV self-testing project in conjunction with JOM Test. Not to confuse this JOM Test, I think.
Not this John test.
The other JOM Test, the Malaysian AIDS Council JOM Test, which is a web-based platform in which people at risk of HIV infection can order a HIV self-test after completing several questionnaires. So the offset is that self-testing has gone up, but facility-based HIV testing certainly has gone down. With that, also, people are less likely, gay men in particular, are less likely to have access prevention services, including PrEP. And also, there has been a concern around disruption of HIV treatment as well, for those who are HIV positive.
Okay, that's really interesting because, you know, I consider myself relatively well plugged into the HIV info loop. I didn't realize that the self-test was already available on web. So how long?
How could you not, Nigel? How could you not?
I know.
It's been running for God knows how. You know, I think it's been running nearly a year, if I'm not mistaken.
Wow.
Yeah, so I'm surprised that you haven't been looped in.
I really haven't. What is there any way to get the website, and how long does it take for a self-test to be delivered to people once they sign up?
Yeah, so you just go to the website. It's just jomtest.com. I think
Okay.
I should know better, but yeah, I can try it out on my laptop. You can try it out now.
Yeah.
And
I'll do that too.
And it delivers you to a web-based platform, and it gives you specific instructions of how to order a HIV self-test kit. Now, the HIV self-test kit there are two. One is an oral-based test kit, which is acceptable. You know, it's basically you don't have to finger prick yourself, and the other one is a finger prick blood rapid test. So you have two options there. It is part of a pilot project, which is being done in conjunction with Malaysian AIDS Council and the NGOs. And so there are questionnaires that need to be filled, and you know, and so forth. So it's done in the form of a pilot study. So it's not just a case of delivering it to you, and that's the end of it. Okay. So we're collecting information on people who are accessing the self-test. But it's a great way to get the test into the house. You know, especially in times of pandemics.
And
for those on in the house,
anonymity.
Yeah, anonymity. Yeah.
Yeah. So it's jom-test.com.
Yes.
So if everyone
I put up the
listening,
website on it. So it's anyone who are watching from home, if you want to reach out, you can actually directly using the website and reach out. So
I'm presuming my other fellow presenters and audience here knew about it, right? Did you all know about it?
Yeah,
I do. Yes, of course.
Yeah. Okay. Great.
I'm glad they do.
we need to know that, because, like, of course, as for myself, my part, the KBK itself, they in this current pandemic, a lot of gays, MSM really need to know their status, but you know, some of the healthcare itself are not what we say, they ada kengkangan, they have their limitation that they cannot do the testing. So we, and as a organization, as an NGOs, give a way to them that they can use a JOM test itself, and they can use it, know their status as well, by their own at home, with their own comfortabilities itself, that we need to know that there is a part of, like, things we share to the community itself.
I think that's
Absolutely.
brilliant. And yeah, I think jum-test.com, everyone. So please go and have a look at that website and share the news, jum-test.com. At the moment, I see that it actually says that there'll be a little bit of delay in delivering because of the pandemic and whatnot. But generally, do you know how long it takes to deliver a kit, Iskandar?
Yeah, so I think you get it within, you technically, if orders are in place, and there have been disruptions to the test kits, but you should receive it within 2 weeks.
Okay.
I mean, Kevin, you've had some issues with this in the past, right? With some, so
Yes,
maybe,
I actually receiving a lot because we are using the name John Test, and then therefore out there are seeing us as also like a support platform. So they also messaging us, and we are regularly receiving requesting about like whether if I could book for an additional kit for like for my friend, and I usually have to direct them back to John Test websites and whatnot. Waiting period sometimes they are somehow exceed the 2 week periods, like you said. So yeah, but I believe it's disruptions of the deliveries. I mean, I myself also registered, so I just want to test it out. How long ago is I actually get a self test? So, and that was 2 weeks
Good for
ago.
you. Good for you.
Thank you. I had to take charge of my life,
Woohoo! That's the way to go, right?
even though I'm not actually doing anything sexually. I still had to. Well, I know myself. I
not?
just had to test it. So take charge of your life
Really?
and
You're not?
and sexual life.
Okay. Actually, that's a good point. Mentally, how are gay people actually coping with this? Same as the straights? Is it more stressful? I mean, tell us, talk to us. Azam, I think Jajaka, being a community leader in Jajaka, you might be able to answer this better than any of us
Okay.
because you're in touch with that.
Since from MCO1, from the starting of the pandemic itself, we Jejaka that working directly with the GBQ's community, we do receive a lot of what we call kita memang banyak terima case, we call it case lah, which is like gay men that need help. Of course, when they are in pandemic, there's two situations. The first situation, either they are staying alone, and the second situation is if they are staying with the family. Okay, if there's a gay man that staying with the family itself, the challenge is totally hard. That they need to, sometimes they've been closeted themselves, but then with the long very period of time, it's hold them up. Like kadang-kadang bila kita menyimpan sesuatu, kita tak boleh nak simpan dia terlalu lama. Kadang-kadang dia akan jadi outright juga, dia akan terkeluar juga. Dan bila yang bersama dengan
you
keluarga,
can't bottle up your feelings for that long.
yes, and then bila duduk dengan keluarga, at least like dengan keluarga yang memang dia discreet, themselves, diorang tak tahu nak channel up their self tu macam mana. Kadang-kadang diorang ambil, mungkin they think that this is a chance untuk diorang open up themselves, tapi who knows that family kadang-kadang ada setengah they cannot accept their children like that. So we as the NGOs itself, helping the community, the gays that needed, okay, if you're being outrighted, that kita ada untuk menolong, in any kind of situation, in kind of ways, even though itu untuk yang gay man. Kalau macam mana pula kalau gay man yang affected with the HIV itself, it's more burden to them. Bukan burden, dia banyak lagi apa orang kata, konflik dalam dia yang diorang kena hold. Jadi kita ada untuk membantu. Kita banyak sangat membantu lah. So currently right now kita dah menolong hampir 50 klien mereka yang memerlukan.
Has there been a spike in cases, and kinds of help can you give? And what's the contact? Twitter itself, jajaka.org on Twitter, or is
Yes.
there a contact?
Okay, if you have someone that needed a help that you can reach through by our tweet handler, you can directly go to the at jajaka.org, and everything that we update for the funds or helping that you need help, everything you can go there. And our team, my team itself, and me as of course the head of welfare to the community itself, we try our best to help the one that affected.
Okay. Is there a phone number to get you at as well? Or
Okay.
not you. I'm not trying to get your phone number. Okay, honestly.
Okay, I think I think I can give my phone number itself. I write it up, so later on nanti Kevin follow
Okay, maybe Kevin can put it up on the screen.
Yeah, you can message to me, then I'll go through that. Nigel.
Go ahead.
No, I just want to chime in on what Azam has said. Actually,
Please.
That is, what there are also other group of individual. If you look into foreigners, they are also losing, like, not just if they're alone, they're not just losing a job, they're losing stability, they're losing a place to stay, they're losing stability in receiving treatments, they're losing, and then there's just a lot of cases where somehow there are increase of drug use. There are increases of riskier sex, just due to pandemic, because, like, I guess when you're lonely, if you got into influence, then it's easier to be influenced by, then therefore you take that risk. There are decrease, however, on preventions, on condoms, on lubrications. It just isn't as distributed as much before. I mean, there is always challenges of delivering and any sort of commodity at this time, but the fact that is that it's getting less and less people asking for that. But perhaps we can talk more about in demands. That way more people can understand that there are other methods of prevention. So I would just want to chime in on that. So yeah, thank you.
So maybe I can ask maybe all three of you a question. Maybe turn the tables around a bit, because a lot of my work is now COVID related, and because our services are disrupted at the hospital level, so we're not seeing as much as we used to. I don't get a sense of whether gay men are having more or less sex during the pandemic. I feel that they're having less sex because of the issues around having to physically distance, but I don't really know. So what is your take on that?
Azam, you want to go ahead?
Who? Sorry?
Okay, so in my experience of reaching out and getting I guess experience stories to share from my client, is that, like, they are having lesser interactions, but they are engaging in more riskier interactions, because they are needed to they're trying to find an escape to go out. They wanted to go places, and if they can go to another person's house and just change the scenery and then just engage with another person and do whatnot, sex potentially, and so that therefore it is more driven to that. You know what I mean? Like the feeling of, like, wanted another person to be. Well, if you in your family house, I want an escape. I go to someone else's house. You know what I mean?
Right.
Like, if I living alone, I'm lonely. I need somebody to talk to. I need that
connection.
engagement. Exactly. You need that attachment. So you find whatever you can. You use the app, and then you watch the roadblock, and you watch the police block, and then you just make your way out. And whatever happened then, in prevention, whatever, it just really went out the door. That's
So
my experience.
has there been a rise in like chemsex and chemsex? I mean, sex is basically how can I put it? Gay men are basically living in a very sexualized world anyway. But has there been an increase in chemsex when you talk about riskier sex and stuff like that?
Well,
Or
okay,
is
so
that still
I don't know. So if it's for me, I need to separate the chem and sex. Very often, people reaching out to others, especially at this point, they're not because of what they want sex. They want someone to talk to. They will invite them to, like, just wanted to have that in interactions, but
And
eventually they lead to sex.
so, and Kevin, sorry, are these with casual partners? Are
No,
these with
no,
casual partners?
these are usually random. Okay, so for us users out there, that what they do is that they're more direct. They're just like, hey, you want to do it together, because they actually just want an interaction, or they want you to do it together, right? So then if you say yes, then the conversation continue from there. If you say no, then obviously nothing's gonna happen, right? But because when you're lonely, or when you're stuck in a place where there's no barrier or boundary, then eventually you find an escape. So that's my experience with my clients.
Thank you.
I've been living a life of a monk, so I might as well just put on robes
You're not
and
alone,
the hair
Michael. You're
shirt.
not alone.
No love, no glove, no love, right?
What? No glove, no love. No love, full stop. Okay.
Okay, sorry. So actually,
No,
I'd like to hear from Azam's point of view, like, because he deals with grassroots and community as well. Whereby I deal with, I guess, Chinese community, those are who does have understandings in sex education, but it's somehow during this pandemic, due to loneliness, due to, I guess, anxiety and other add-on stuff, family stress, work stress, you
Yes.
can never accomplish anything, especially when you're locked down. You just feel like, just so uh, you everyone bring back the closet. Just want to point out another thing is that the I'm not sure this is the right platform. It's just saying that there's a law brutality has increased as well. That also create
sorry,
a
Kevin,
huge
what was that? The
anxiety.
law? What?
I'm just saying that there is a lot of like law brutality toward LGBTQ community has increases. I was affected. I don't go out anymore. I haven't been stepping out from my house for 2 months. Okay, I just generally have a fear going out. The law is not
Yeah,
protecting us.
I keep my travels to a minimum because I've got my 88-year-old dad downstairs. He's just had the second vaccination, so I hardly go out unless I go out to buy groceries for the house or whatever. So I'm pretty much housebound, and now even with the dine-ins and all that allowed for double vaxxed people, I'm a bit wary of that for now.
So
Yeah.
yeah, I absolutely agree. Like, I mean, the increase of like CAM is not because of like the want to say. It's actually mental health. People are lonely. There are people that are really finding a way to reaching out. So um, like if we wanted to look past that sex, we can talk to them just generally, like, do the connection. I'm sure that that's what they're actually trying to reach out for.
Are
So in my
there
experience, I would separate them both, like in different topics.
Are there
Yeah.
are there numbers or, with regard to whether or not chemsex has gone up? Are there surveys numbers that we know of?
I don't
Not
know.
that
I
I'm
don't
aware of.
think. Yeah.
Ile.
Yeah.
Okay. Okay.
I mean, okay. So like,
Just
how
asking.
how are we going to collect those data?
No,
And this
it's
topic is
hard, of
so
course.
is
Yeah.
stigma, So it's not. Yeah. I mean, we love to do a data collection on this, but how many people are gonna step out and say, "Hey, I raise my hand. I'm the," It's no one gonna do that.
No, but you can do it as part of surveys at NGOs from MSM and gay-friendly communities, and not specifically centered around uh, chemsex, but it could be centered around mental health and the consequences of being locked down in the pandemic. And part of that could be extended into riskier sex, as you say, and part of that would involve chemsex. So I think that's the way to go about doing it, because it has consequences, right? If people are
I
engaging
see.
in riskier sex and more chemsex and prevention measures are sort of being hindered, then you have the tip of the iceberg of a problem of the consequences of those actions, right?
I agree. I know
Coming,
of sorry, go ahead.
no, I just wanted to say, because I'm guilty. So I went for my first lunch dine out today with,
Oh,
you know,
How was that?
and I know
how
I
I
was
kind of
was
that?
very
live
proud. So,
vicariously.
and
I was planning like today dinner.
so, but you know, it was my first time with a, you know, and I did it. I did it, and it was outside. It was just with another person, um, and we were both fully vaccinated. And in fact, the staff showed us also their vaccination or confirmed their vaccination status. So, and there was probably two other people more than sort of maybe 2 feet away from us. And you know, on the other hand, I found it you know, almost it was a lovely experience to be able to dine out uh, in you know, in a circumstances where it probably is not the wisest to dine out yet, admittedly, but it also helps with that interaction and the mental health issue. You can do things safely though, and we
Yeah,
have to we do have to think about gradually returning to some form of normalcy for those
normality.
who are,
Yeah,
yeah, for those who are fully vaccinated, you know,
absolutely.
and one of that is maybe keep it to outdoors, you know, but you certainly have to, you know, we have to get out there a bit more, and outdoors is probably the way forward. So if it's dining, forget dining in, but dining out, you know,
I
that's one way of
thoroughly agree.
risk reduction.
I thoroughly agree. To be honest, I am looking for a bubble amongst my family. Those who've been double vaccinated, I know don't go out very much. Maybe to have dinners at home, but outside on the porch.
Yeah,
Just so that we can return to some normality, because it's
yeah,
been 500 odd days, and this is just not it's not something that can be kept up for much longer. I
yeah,
must
exactly.
admit, you know, you're talking about the dine out, the that announcement. You know, in my head, I know it's not the best thing to do, but in my heart, I felt this sense of liberation when I
Yeah,
heard that announcement.
absolutely. Because
Yeah, I
because
felt just so,
you know,
oh
yeah,
God, thank God. No?
because because I think we all feel we've all reached the stage where we're working towards getting as many people vaccinated as much as possible. Right now, we've almost reached, or we've reached that point within the Klang Valley, you know, or reaching that point, and hospitalizations, fortunately, are beginning to see a decrease in admissions. So the benefit of vaccinations has already begun to sort of be seen in terms of its impact in the number of people having to be admitted to hospital, which is a relief for all healthcare providers. So,
Oh,
you know, I
thank
think,
God.
yeah,
That's
yeah. So,
that's a really good piece of news, because all we ever see are the numbers of infections.
yeah, no. So over the past maybe 2 weeks, the number of hospitalizations and patients requiring admission for, you know, category 4, 5 COVID have started to decrease. So, you know, it's excellent
That's
news, and it's,
fabulous. That's
but of
excellent
course
news.
we've got to see whether that sustains itself with time. But you
Yeah,
know,
yeah.
that's largely due to the vaccination surge in the Klang Valley.
How many people, actually, out of curiosity, how many people in Klang Valley are vaccinated now, or at least have received one dose of the vaccine?
Yeah, I think that was about more than 80. I think we're nearly 90% first dose. We've done
Okay, and
extremely
double
well.
dose, about half?
So double dose, if you include the adult population, so not excluding children, it was nearly 50%. Yeah, about half.
That's one thing we've done right, I must say.
Yeah. Absolutely. And hopefully it maintains itself with a new political cabinet, right? Because, I mean, you can't get away not talking about politics in any form of way, even if this is about gay men and sex and the consequences of that.
That's political. Yeah, but how? I think that question about, so what is there a sort of, I won't call it a solution, but is there a mitigation in terms of how we get gay men to not have as much risky sex? What else can gay men do in terms of connecting with people without actually taking as much of a risk? This is for the floor.
Well, can I, I'm a big proponent of HIV prevention, biomedical prevention, so PrEP basically. And, even in times of lockdown and disruption of services where gay men cannot or are not able to access PrEP as often, there is still, I think Kevin touched on this. There are ways that you can maximize the amount of PrEP that you have at home, whilst reducing, whilst maybe reducing the number of sexual partners that you have, because you're not having that many sexual partners. So one of that is to take it, other than dailies, to take it a different way, on demand PrEP, and that is done in such a way that you're taking it in relation to the sex that you're having, and not having to take it on an everyday basis. Because you could argue that if you're taking PrEP every day and you're not having as many sexual partners, then you're really consuming something and it's not going to be achieving its endpoint because you're not really being exposed. So I think one way of just is to increase the awareness around taking PrEP, that there are other ways of taking PrEP. It's not just the daily PrEP, but it can be very confusing for a lot of people who take PrEP. I know Kevin's mentioned this a couple of times. The messaging around taking PrEP in relation to sex or on-demand PrEP can be very confusing, not just to Malaysians, but to gay men globally. So I think the NGOs could do a bit of work around the messaging around alternative ways of taking PrEP, especially in periods of lockdown. That's one way out of many ways to counteract risky sex, I feel. Because PrEP is so effective, PrEP in preventing HIV infection.
Yeah, agree. I just wanted to resonate a little bit, if it's okay, Joe. It's just that, like, I just don't think people understand the value of PrEP enough. Because, like, if you want to talk about awareness, right, is usually down to like the clinic or the NGO themselves or the community workers. It's not largely or hugely reach out to other group of people. Like recently, I found it very interesting. I was in Clubhouse, which is a very different demographic, a different group of people, and then they begin to talk about sexual health, and then I was like, start chime in about PrEPs and other prevention. It would literally shock everybody, and how much relief people actually heard about there are preventions and there are different methods of taking about PrEP. It's just that I was pointing that out. It's just awareness is just not enough. It just hasn't been hugely promoted on televisions or radio.
I agree.
So why do you think that is? Is it because we're not allowed to display this on the billboards, on TV? Why do you feel that these awareness messages are not reaching the people who would benefit most from these interventions? And what can we do better?
Put it on national televisions. Put it on national boards. Put it on every single clinic. It should be public announcement. So it shouldn't be, right? I mean, I find it very interesting that like these are younger generation. They're like 20, 21, and I was speaking to them. They were just like curious about this, and I know they are curious because they are at their 20s and they are wanting to learn. but I still think they can't find a lot of information out there. If it, like I said, sexual health prevention, all these are very important. It should make it a national target. It should make it a national policy. So that way it should be displayed everywhere. Sex education in school, sex education in any form.
I'll say this. I think it's partly to do with the stigma of number one, sex, and number two, because it's associated with the gay community.
Absolutely.
So I think that stigma is preventing the messaging from getting out. Yeah, we've got to do. You want to talk about PrEP? I've talked about it with some gay men, and some gay men, albeit a small number, have said that no, we shouldn't push PrEP so much because then it'll make gay men even sluttier. Which is a total fallacy, but that's the sort of attitude you've got to deal with.
Yeah. No, I think. Sorry, this is a real thorn in my side when the counter argument for persons going on PrEP is that they have more unprotected sex or increase their sexual partners. Even if they do, so be it. Because it just means that they people who are using it have faith in something that they're taking, which prevents the outcome, which in this case is HIV, which means you have faith in a product that works. And ultimately, it puts condoms and PrEP side by side. It's up to the person who wants to use whatever is more suitable for their sexual life, right? So if condoms suit you, go ahead with condoms. If PrEP, if condoms are not so much your thing, go ahead and use something else like PrEP. Or if HIV testing and finding out the status of your partner is more important, then you can use treatment as prevention. So it's such a shame that counter argument is still happening, because it shouldn't, because we really should move on from, I feel, from those discussions. And this is all about personal choice. PrEP allows people an extra prevention choice in an array of choices. I mean, condoms have been used since God, and they have remained the main form of HIV prevention strategy for decades. And they've served well. They've served a lot of gay men well. But something else is on the block. Why not test it out? Why not play around with it? And why not indulge in it? And if it suits you, go ahead, continue taking it.
I think part of it is also the whole newness of it, and then when they're told about the side effects, the possible side effects of damage to the liver, the kidneys, etc., they are also a bit wary of that. There's that as well. Once they hear of PrEP, okay, they'll ask, is it safe? That's the main thing.
And the answer to that would be absolutely safe. For somebody less, for young men in particular, anybody less than the age of 40, and without any risk factors.
That's young.
Yes. You're considered young if you're less than 40, and anybody less.
That's it. I'm in the twilight of my life now.
There are no concerns. The risk of it's mainly kidney. It can potentially affect the kidneys, but even so, the effect is mild. It doesn't happen all of a sudden, and it's prevented by engaging in care and taking blood tests every time you go back to the clinic and get your top up of PrEP. Okay, so it's easily preventable.
As Iskandar knows, he was the one who actually encouraged me to go on PrEP, and I did when I was single. So I did that study with you, and I found it to be all good. I didn't have any side effect, and I can tell you I'm far north of 40. Very far north of 40.
Reza,
Azam, perhaps
I
you
think
can.
I think I can add. Okay, part daripada yang Iskandar bagi tahu. Yes, of course we always give an apa, the knowledge about the importance of the PrEP itself. But I from my observation of what we're dealing with, a lot of the youngsters itself range around 20 to 25 itself. When we ask them like how about you use a PrEP together with the condom to prevent yourself have a prevention from the HIV itself. And when we said about a cause, that is one of the main thing that they're looking forward on it, because like with when you need to do the checkups and the medication itself, uh, I can say that majorly of our client, they are not capable enough to have that have that funds to get themselves tested for the kidney functions, the liver functions, and of course when they went to get the stock for the PrEP itself. But what we do is that if you want to have a sex, you just contact with our NGOs or other NGOs. We can give you a lot of condoms itself. You need a condom, you just let us know, we give it to you, because for us your health status is much important than the other things. We know that in this kind of pandemic that they need something to what we call it, to keluarkan balik dia punya perasaan. You cannot go anywhere, as like
Sorry.
Kevin said, and of course like Kevin said that people always like just open their phones, and then whoever, sometimes that the people next door, oh, you're there, okay, I just want to have sex with you.
Basically, people are looking for a connection, lah.
I'm just saying. I just want to chime into what Azam said. I noticed that people are more attached to their phone at 99% increases because they're constantly look out for connections, and so I just wanted to chime in on one of the masalah yang face again, condoms and lubrications. So I did some promotion a few times, right? And then what we get back was wonderful. They were like, "Oh, thank you very much for doing this, but I don't need it."
Yeah, that is the thing. Sometimes that when we also receive that a lot of situations like, oh, we don't need that condom and lubrication. Of course, that I'm only playing with this only one partner. But the important is like the help is there, the use is there, the help is there. Why don't you use it? I'm not saying that. Okay, I hope people's not misunderstand with my statement. Okay, what apa dia macam takkan dah tak boleh. I takut that benda kat itu macam, prevention is much better than happen. That is the best word that I can use it.
The old saying, prevention is better than cure.
Yes, prevention is better than cure.
Can I just chime in, Azam? Because one of the persistent, you're completely right. People, the arguments for PrEP is the cost of it. Okay.
Yes.
But let me put things into perspective. Okay. The cost of PrEP. Okay, the cheapest cost of PrEP, let's say, is in UMMC. It costs about 30 ringgit, which is one ringgit a day. Okay, that's the cost of PrEP in UMMC. In NGOs like PT and in private clinics, they can go up to 2 to about 4 ringgit a day, let's say on average, okay? Sometimes up to 5 ringgit a day. But let's say, I think like PT, you can get away with about 2 to 3 ringgit a day, okay? It also depends on what people want to prioritize their money on and what they feel. I mean, for people who smoke, they're more than willing to spend that on cigarettes. But they may not be willing to spend on a pill. And then the drug PrEP itself used to be very expensive before. It used to be at least 300, 400 ringgit in the private sector, and it's gone down significantly price. because it is part of HIV treatment, and the price is considered at the moment relatively low. But of course, it's not low enough for young MSM, young gay men, who really should be the target of any HIV prevention strategy. So number one, I think it's the priorities. You can get relatively cheap PrEP if you look for it. It is possible. And I always say that, so, and I keep on chiming the price is that because that's a reality. You can get PrEP as cheap as that in a particular place. The other thing about condoms are so important. They are, without a doubt. But in the heat of the moment, some people are unable to, let's say, control their risk. For example, you have a passive partner who is unable to ask his active partner to put a condom on. So especially with that disparity in age, sometimes there is that you cannot control your own personal risk at the time that you're actually putting yourself at risk. And that's where condoms fail, I feel, and where PrEP can come in, because you take a pill way before the actual sexual risk takes place. And by the time you're there, you're all protected. You don't have to rely on you putting a condom or on someone else using a condom. And that's where young MSM are particularly vulnerable. And that's where I see it could potentially help. Apart from,
basically,
as you say,
it brings back spontaneity, doesn't it?
Beg your pardon?
It brings back spontaneity. Condoms
can
be a bit,
and you can enjoy, and it brings back. Yeah, I mean, it brings back spontaneity. People report a better mental health. They don't worry so much about HIV.
Peace of mind.
HIV of their
Absolutely.
mind, because they're protected already way before they put themselves in that situation. And this is what I think what we forget to talk about when we talk about PrEP. We don't talk enough about the positive benefits of PrEP on mental health, on making sexual health more pleasurable, and really just putting HIV behind and not being the most important thing in your mind at the time. That's what I find,
Iskandar, you mentioned that PrEP is 30 ringgit at Are there any other centers around Malaysia that sell it at that price? And number two, what's the procedure for getting it?
No, this is the price that it's a tendered price to all hospitals, public health hospitals.
All
so
hospitals.
They get it right. Yes, but it's. I think UM is the only one that's offering it, because other hospitals just want to concentrate on HIV treatment. HIV prevention is not really considered on the same scale or as an important priority. So, but because I lead some of the services and with a good group who also believe that HIV prevention should be made available in the public sector, that we have been able to do that. Okay, but and the difference in price between the public sector and private sector is largely because there is a slight difference. Okay,
you broke up there.
There's a slight difference between the public pricing and the private pricing. So, some private clinics will get it for 55 or 60 ringgit, and then they mark it up a bit more. And so that's why it's more expensive, Azam. It's not because people are not trying in the background to try and reduce the price. It's also because most of it is available from the private sector, and private sectors naturally want to mark up the price a bit more so they have some profit, which is understandable. Actually, pricing which is offered to them is not that high. So it's a combination of factors.
It's a very good point, Doctor. I think that it's a very good point that we will try to educate more people that one of the thing that I get that when you say it's about the prioritize itself. What is the priorities? Apa yang diorang prioritizekan dulu? Some, of course, like Doktor kata that you can buy a smoke, but you can buy cigarettes, but you cannot buy a PrEP itself that only like 30 ringgit from the MMC. But I think that we can giving more apa the advocation in terms of using PrEP itself to the gay men that were having sex.
Just off the top of my head, are there any moves to sort of package PrEP, not just in a bottle with 30 pills, like one a day, but PrEP on demand? I mean, you talked about that, and that's what I wanted to ask if you had. Number one, how does PrEP on demand work? What number of pills do you take over the course of a few days? And is there a move to package it within sort of like, okay, you sort of know you're going to go see someone this weekend. Let's go get 5-6 pills so that I can take this PrEP on demand. It may be cheaper than taking the PrEP for 30 days.
Yeah, so Kevin might be able to answer some of these questions also, because PT was involved in a Take Charge program, and the plan was to move that forward, whereby to roll out PrEP access, but mainly in the form of PrEP demand, for gay men who wanted to engage in a heavy weekend, so to speak, and then they would package it with 4 pills plus condoms plus lubricants, and they would be sorted for that particular weekend or so. And if it was 2 weekends in a row, they would be, I guess, given 2 times 4 pills, which would be 8 pills, or probably a bit more if sex continued to happen after that. And I think they got sort of halfway, and maybe Kevin, you could talk about that, because it was funded, this whole program of awareness around. It was an awareness program, but I think later centered around on-demand PrEP. They ran out of funding, and so it was not scaled up to the point where they could potentially have been useful and accessible for those who wanted to access on-demand PrEP. So that is maybe Kevin could add a couple of words to there. In terms, what was the second question, Nigel? There was a second question. How do you take it? Is that right?
Yeah, the on-demand PrEP. How do you take it?
Yeah. Okay. I'll tell. I thought this was about COVID and HIV, but
I know, right? But don't worry, I'll bring it back to COVID in a minute.
but look, I'm extremely happy to talk about PrEP. So basically, you take 4 pills around any episode of unprotected sex. So in order for you to sort of use on-demand PrEP, you need to know when sex is going to happen. So let's say a typical scenario, Friday night, 11 o'clock, okay? Let's say you've planned something and you're going to meet somebody Friday, 11 o'clock. So you're meant to take 2 pills, 2 to 24 hours before the act, okay? So what often happens in reality is that the person takes the 2 pills on Friday morning, so maybe 12, 13 hours before the act. The act happens at 11 o'clock on Friday night. The person takes another pill 24 hours later, and then another pill 24 hours later. Okay? So 2 pills before the actual sex itself, and 2 pills after the sex itself. Okay?
Okay, so correct me if I'm wrong. It's the 2-1-1 thing, the 2-1-1 rule.
It is the 2-1. Yeah, sorry. It's interchangeable. Yes, it's 2-1-1. Yes, okay. It's 2-1-1.
Good.
Yeah, it's exactly the same. Yeah.
Okay.
And there's a very good website. I want PrEP Now. It's a UK-based website, and it explains it very well on how to take PrEP. It has several videos of how to take PrEP and what you do if sex continues, and it gives you different scenarios as well.
It's very well informative website.
Okay, cool. All right, let's bring it back to COVID. PrEP is very, very important. I think that the messaging on PrEP needs to
I just want to chime in before we move on to COVID. What we talk about PrEP is actually I important. The reason I said it's important because it is part of the self-care. It's part of the form of self-care. I need to think of a different narrative to it. Like what Azam has said, we need to begin to do a different narrative to promote a different form of self-care. It's look after yourself. Sexual health is a form of self-care. So so I totally agree with that. And then it is important, especially during the lockdown, because I does see increased numbers of riskier sex. So I do emphasize it. If you we as a community leaders, we had to begin to sort of change our mindset and then begin to that way we can actually bring the narrative down to the communities. Anyway, let's move on to the COVID.
actually, just Kevin, just before that, and because this was brought up in this, one of the main drivers of HIV infection within gay men is chemsex, is the rise of chemsex, right? A lot of gay men are experimenting with chemsex and putting themselves at risk. So, and what happens during these chemsex get-togethers is that a lot of people engage in unprotected sex because they're on substances. And so therefore, HIV prevention, in particular with condoms, and Azam, this is where I'm throwing it back to you, are thrown out, okay? Because not many people are probably going to use condoms when a bunch of guys come together and want to have sex. So condoms as a HIV prevention strategy is not going to work there. And this is where we find that if you get these guys who engage in substances on PrEP beforehand, they're okay. They will continue taking the PrEP, and they are protected from HIV. And they can continue doing whatever they want to do and enjoy that. But they don't get infected in the process,
Absolutely.
And so that's one aspect, as Kevin put, of self-care. You're caring, you're thinking about yourself, preventing HIV. Now, the substance aspect is, of course, completely different and probably needs to be addressed if it's problematic, But at least whilst you're doing it, you know that you're protected from that point of view. And that's the reality of it. I think if we just are just promoting condoms there, we are failing these group of people who engage in high-risk activities there.
Absolutely.
Absolutely correct, Doctor.
All right, COVID.
COVID. We have to look at COVID now.
A couple of big quick picture questions. Okay, how has COVID impacted HIV research into, number one, cure, vaccination? How do you think COVID has? This is a very big picture question, obviously. How has COVID, because they're both viruses, how has it impacted HIV research into the vaccination, into a cure? Yeah.
So well, the obvious thing about COVID is that all the research now has been most of the research has been directed towards COVID, and so any form of HIV research has been disrupted tremendously in whatever form, because everything is being directed towards COVID, which
because
is why
COVID's not a gay disease.
So that's the first thing. But I think the question you're asking is, the mRNA vaccines, so the Pfizer vaccine, the Moderna vaccines, already laid years of the platform towards building up a COVID mRNA-based vaccine. So when the pandemic hit, it was already as if this was already ready for it to be used, because a lot of it was already waiting to be used. And so the epidemic hit, and it was an opportunity to use the mRNA technology. A lot of that work is now being directed towards, and I know work is being planned for a HIV vaccine using mRNA technology. I forget which one. It's not Pfizer. It's Moderna, if I believe correctly. So Moderna is now, I think has just announced sometime this week that they are going to be starting early phase trials of a HIV vaccine using mRNA vaccine. So, and I think mRNA vaccines are going to be used not just for HIV, but also for many other infectious diseases. We've seen the success of it clearly in COVID, and there's no reason why we should not push it to other infectious diseases.
Okay, that's good. That's really good. So basically, COVID has sort of, you could sort of say that it spurred the production of the HIV vaccine.
Yeah, no. So we've had a couple of HIV vaccines, but they've all been disappointing to say the least. But none of them have been, as far as I've been aware, have used mRNA technology. So the Moderna will be using it, as far as I'm aware, for the very first time.
Okay, talking about the vaccines, do you have any medical advice for PLHIVs with regard to the COVID vaccines? Is there anything that they need to be aware of? Any side effects? Basically, they're people with comorbidities, correct?
Yeah.
Could I also just ask a little bit, because I noticed that I do have some clients with PLHIV. They just ask me a question like, is it, because I tried to reach out to them and say, oh, there is a vaccine place that's open up, I can book you in, etc. They will ask, what was it? Is it AZ? Because some of them are maybe don't want to take like certain vaccine. Is that the differences, or can you maybe explain a little bit on that? Because I'm just curious.
Yeah, okay. So I'll try and answer the first question, and I'll go up to your question, Kevin. So everybody should have hopefully had their first dose of vaccine by now. That's irrespective of whether you have HIV or not, whether you're a gay man or not. Okay, that's first. I mean, because there've been ample opportunities to. I think a lot of the misunderstanding initially, including by the Ministry of Health, was that people living with HIV, which were thought to represent a group of people with impaired immune systems, so their immune systems are not meant to be as good, were considered to be, at first, by the Ministry of Health, anyways, not by the global health, a risk that would develop most. I think there was a misunderstanding that this group was contraindicated, and I'm not entirely sure why, because they're the very group that you want to be prioritized, because anybody with comorbidities, as you say, so diabetes, hypertension, heart disease, those with HIV, those with previous organ transplants, cancers, be it blood cancers or otherwise, are more likely to develop severe outcomes of COVID if they have COVID. So they're more likely to develop severe COVID and die. The data from COVID, if they're infected with COVID. The data with HIV at first was a bit iffy and all over the place, but now more or less we know that people living with HIV are at risk. They're at least nearly 2 times at risk of developing severe HIV and to die from HIV if you're hospitalized with COVID. So the data is a bit more clearer, although there are conflicting data and different data sets. Some say yes, some say no. And so therefore HIV should be prioritized in people living with HIV. The misunderstanding often is that people with comorbidities feel that the vaccine is in fact contraindicated, or they're more likely to develop problems or side effects with the vaccine. But that's not true. On the converse, you want people with comorbidities and with lower immune systems to be vaccinated and to be considered as a priority. So that's in answer to Nigel's question, okay? In answer to your question, Kevin, right now it's still difficult to choose, but you sort of know at the moment which vaccine centers do which vaccine. And I think I mean, the different vaccines differ in the different types of technologies that they use. The Pfizer vaccines are mRNA based. The other vaccines are not. They're based on older vaccine technology, but they're equally as effective. What is coming out is that probably the Pfizer vaccines are a bit more effective than the other vaccines, but this was with the COVID virus before Delta variant came in. And now the Delta variant, or the new variant, which is currently circulating, has changed a lot of that. The vaccines seem to maintain effectiveness against severe disease and being hospitalized if you develop severe COVID, but they probably are less effective at preventing infection. And that's why you see a number of what we call breakthrough infections. That means infections that occur in people who are fully vaccinated, that an increasing number of people are getting these breakthrough infections. But more importantly, they are not ending up in hospital, or they're not getting severe disease. So that's an important message to come across.
Thank you.
Okay.
Okay.
Appreciate that.
Thanks, Iskandar. The thing is, so let's summarize this. In other words, your recommendation is get any vaccine. It's better than not having one at all.
Absolutely.
Okay. So you heard it here. Get any vaccine if you haven't got vaccinated. And if you have, good on you. You're looking after everyone as well as yourself. Right. Last question. Does meth, chem use, or even HIV medication interfere with the COVID-19 vaccine? Let's break
Does
that
meth-
into two. Does chem use, meth, interfere with the COVID-19 vaccine, or does
Medication.
HIV treatment, heart, interfere with the COVID-19 vaccine as well? Yeah, so two questions.
No. So I'll go for the second. I'll answer the second question first. HIV treatment certainly does not. There are very few contraindications to HIV to COVID vaccination. Even a history of allergies is not a contraindication to COVID vaccination. In fact, I struggle to find anything or any reason why somebody would not be able to be vaccinated with against COVID. Full stop. And you need to have a bloody good reason for that, for anybody who says that, you know. Secondly, does HIV treatment, what was the second one? Does meth use affect COVID vaccine? Does it affect the interaction with COVID vaccine? It's not been studied formally. So I don't think
Sure.
I can say for certain, but it's, once again, it would be very unlikely that it interacted with the COVID vaccine, would be my answer. And another question not posed, but I just wanted to mention, does meth interact with HIV treatment? So most of the time it doesn't, but patients on a drug called Kaletra or any protease inhibitor, it can interact with meth. And what it does, it can potentially increase your meth levels and make you more susceptible to the effects of meth. So that's for those people who are on second-line treatment, which is largely protease inhibitor based. The most common example of that is Kaletra.
Okay, there's a question that we've got. Should PLHIV voluntarily disclose their HIV status when they go for their COVID-19 vaccination, even if they are virally undetectable?
So most centers are not, in fact, you know, as I mentioned earlier on, people with HIV should be prioritized, and they are prioritized. We've been lucky in this country that they have. So there should be no concern in disclosing of HIV status at the HIV vaccine centers at all. Their priority is just to get as much people vaccinated as possible. And in reality, they're not turning many people away. There should not be turning people away, and certainly not people living with HIV. So it doesn't matter. So if they are virally undetectable, that is better, because if you are on treatment, you're virally suppressed, your immune status is high, you're more likely to respond to the vaccine, because you have in order for you to respond to the vaccine, you need to have an immune system, right? So if you have an immune system which is good and protected by HIV treatment, you're more likely to respond. For those who are not virally undetectable, or for those who are not on treatment, they shouldn't be turned away either, because there's so much COVID at the moment that, my advice at the moment is, because there's so much community transmission, that even though ideally you should be started on treatment first for at least 4 weeks, but if that's not possible, then just get the person vaccinated as fast as possible, given the high level of community transmission of COVID that we have now.
Okay. Well, you know what, Kevin, is there anything else to add? Because I think we're coming to the end of the show.
Actually, I don't have any additional question for the. Thank you for answering the question, because I does have a lot of clients who reaching out and asking me which vaccine they should take, and then they heard many different questions or information from out there and different various. So that's why they get confused. They just stop. They just like, I don't want to go get vaccine. I was like, but like you said, everyone should get a vaccine. So I think that should able to hopefully clear up some of the misunderstanding that people are probably still questioning. But most of them, my clients, most of them are vaccinated. So
good.
Yeah.
Good. That's great. So I think we've come to the end of this particular segment of the PTF show. So thank you so much. I want to say thank you so much to Dr. Iskandar Azwa and to Azam for gracing us with your presence. It's been a real privilege having both of you. But before we go, perhaps everyone would like to take a minute just to wrap up and speak their mind on whatever burning topic there is that you'd like to highlight.
Actually, Nigel, there's a question from the audience. So as from this one, what is the risk factor of someone which involved in multiple risk behaviors, taking like PrEPs on demand and subsequently contract HIV, turns out reactive on HIV? Do you have a recommendation to be cautious on this?
Sorry, what was the question?
I think the questions are more on involving people sort of using PrEP on demand incorrectly, and then somehow subsequently contract HIV, turns out to be reactive, even though they are on PrEP, right? So I guess this question probably direct to Dr. Iskandar.
So I thought we were wrapping up, but okay. The risk of developing. What is the risk factor for somebody who is taking PrEP on demand and subsequently develops HIV? So the concern is that if you develop resistance, and there is resistance develops largely in the setting that when somebody is taking PrEP has not taken enough of PrEP. Now, on-demand PrEP is slightly different because if you're keeping to the schedule, you really should not be developing, or you should not really develop HIV. The science and the data shows that. On-demand PrEP is equally as effective as taking daily PrEP. Okay, so that also needs to come across. If you do develop HIV, whilst you take on-demand PrEP or daily PrEP, there is a small risk of resistance. That risk of resistance was thought to be bigger and more important in terms of the consequence of what could potentially happen. But now we know that it is not so. It doesn't impact on your subsequent HIV treatment that you start with. Okay, so in short, there is a risk of developing resistance. That resistance is not big, and it shouldn't complicate your HIV treatment that you get started on later because you've developed HIV. Okay? It doesn't mean that you need to be on some super duper powerful medication as a result. No. You can still get away a lot of the time with being started on the first line HIV treatment regimen that is recommended for most people, and most people do well with that combination.
Thank you, Doctor. So I think you follow up with what's the possibility of someone who's on PrEP, contact for HIV, and get viral resistant on 10 to be specifically.
I think Iskandar's answered that too.
I understand. Yeah, because I think what because I'll try to get that and like okay. So right now I'm trying to make sense of this, right? So would you say that like PrEP, either PrEP or different regime, right? In combinations of with other prevention like condoms and lubrications, would that be probably the safe bet that they would recommend?
Yep, absolutely. Combination HIV prevention can't get better than that. If you throw in PrEP, throw in condoms, throw in lubricants, make it hard for you to get HIV. Absolutely.
It's like Star Trek force field.
No, not force field. Oh my gosh.
Close enough. Force field's got gaps also, okay?
Basically,
Okay.
Are you saying like a human like a force field? We just be shoot with different directions. That's what a Star Trek is.
Thanks, Kevin. You like that, do you? Get shot from at all directions.
Yeah.
Start again, try again. Okay, I think we're at the end. Okay, guys, why don't you just wrap up? Iskandar, 1 minute, and 1 minute. Azam, 1 minute. Kevin, 1 minute. And obviously, I've taken my 1 minute. Go.
So since this was really meant to be more COVID and HIV, I think, or COVID, so just a reminder that everybody should get vaccinated. Okay, there's no reason why anybody should not get vaccinated. The vaccines are extremely safe, and there are very, very minimal side effects. And anyways, even if you're arguing about getting vaccinated, there's a high likelihood that you might need a booster within the next couple of months. So, you've had all this conversation around getting vaccinated, and you'll end up with a booster. Okay, but just get vaccinated. That's all I have to say.
Okay. I think that this can also brief well for the COVID. Maybe I can add on for just one thing, that we need to take care of ourselves personally.
Amen.
Take care of ourselves, and if we take care of ourselves, then we taking care of our community and surrounding. That's all.
Thank you, Azam. Azam, would you like to give your contact details again, please? Kevin, maybe you can put that up to repeat.
Yeah, sure. Okay, you guys can contact me through Twitter itself at jajaka.org, or you can WhatsApp me. Kevin will put my number down there. But I prefer that you get me through Twitter itself.
Twitter,
it's much easier.
yeah.
Yes, Twitter. Because if you need to understand more what Jajaka does, what we are currently doing in Twitter, we are more in Twitter itself.
Cool. So thank you so
Thank
much,
you so
Azam.
much.
And Kevin, anything to add to that?
Well, I initially, when Doctor is gonna talk about booster, and I was just thinking like there's so many questions about booster, because I got lots of clients talking about booster, and now we are actually coming to the end, so I'm not going to get into that, but hopefully we can get more information about the booster part, because there is a lot of questioning about should I get a booster, or what is the, just throwing our questioning out there. But I really appreciate the whole session this afternoon, and hopefully all this information can be get out there. I just want to end with like sexual health is a form of self-care. You know, prevention, sexual prevention is a form of self-care. Look after yourself, and mental health, and reach out to any of us. Reach out to all this information that we have shared online. On CFCC, you can go there and ask for your any other information about sexual health. You can reach out to us on IG. You can reach out to Jaka through Twitters, his personal numbers. Invite for coffee if you wanted to. You know, it's just like reach out. You're not alone. Okay, no one is alone here. So we're doing this. It's basically trying to get the information out there, and so you can reach out to us if you need help, and we are always here for you. I'm done.
Lovely, lovely. So thank you so much for everyone who actually signed on to watch. I've talked more than enough already. So thanks so much, and have a great weekend. It's a sunny day outside. Go out for a walk and get some vitamin D. Goodbye, everyone. This is Russell from the PTF.
Thank you very much, guys. Also, I don't know what happened.
Yeah, don't laugh. Okay, don't laugh.
All right. Thank you very much, guys.
Bye.
Thank you. Bye.